Reducing the risk of stillbirth. Please click like and subscribe. Not all the causes of stillbirth are currently known, but experience suggests that if pregnant women know the risk factors, the signs to look out for and when to seek help, this can reduce how often stillbirth happens. It's not possible to prevent every stillbirth. But we do know that certain factors increase the risk, and there are simple things you can do to reduce these risks. Eat healthily and keep active. Try to swap unhealthy foods for healthier options, and try to keep active. Being overweight or obese can increase the risk of problems in pregnancy. Pregnancy is not the time for a weight loss diet. But you don't need to put on any extra kilos in pregnancy if you're already overweight. Stop smoking. If you smoke, the best thing you can do is to stop. Passive smoking, breathing in smoke from other people's cigarettes, is also harmful in pregnancy, so avoid being around people who are smoking if you can. Avoid alcohol in pregnancy. The safest way to ensure your baby isn't damaged by alcohol is not to drink while you're pregnant. If you're finding it hard to stop drinking, ask for help from your midwife or GP. Find out about alcohol and pregnancy, including how many units are in different types of drinks. Go to sleep on your side. Research suggests that going to sleep on your back after 28 weeks of pregnancy doubles the risk of stillbirth. It's thought this may be to do with the flow of blood and oxygen to the baby. The safest option is to fall asleep on your side, either left or right. Don't worry if you wake up on your back, just turn on to your side to go back to sleep. Tell your midwife about any drug use. If you use or have used street drugs, such as cannabis, ecstasy or heroin, or other substances, tell your midwife. The more your midwife knows about your general health, the better she or he will be able to help you and your baby. Don't be afraid to share this information. It'll be treated in confidence and only shared with other relevant professionals if the midwife thinks it's in the best interests of you and your baby. Frank has information about the risks of legal highs, which aren't necessarily legal or safe. Have the flu jab. Make sure you have the seasonal flu vaccination, which is available from the beginning of October each year. Pregnant women are more at risk from flu complications, such as bronchitis and pneumonia, than the general population. These complications can harm your baby. Your midwife or GP will offer you the flu jab. It's free and safe to have at any stage of pregnancy. Women who have had the vaccine in pregnancy also pass some protection onto their babies, which lasts for the first few months of the baby's life. Avoid people who are ill wherever possible. Avoid contact with people who have infectious illnesses, including diarrhea, vomiting, and childhood illnesses like chickenpox or parvovirus, slapped cheek. If you have been or are in contact with someone with an infection, speak to your midwife or GP for advice. Wash your hands. Be strict about good hygiene wherever you are. This includes washing your hands to reduce the risk of infection, particularly before preparing food, after going to the toilet, after changing a nappy. If you already have children, prepare and store food safely. It's important to prepare and store food safely to reduce the risk of infection.